Hello, everybody. Welcome to a really, really special show. Get the word out with Project Next with me and Tim. We are talking about the Harrison County Hospital here in Corydon, Indiana, and why rural hospitals like ours are under real pressure. Harrison County Hospital is a county-owned hospital that served this community since 1950. It doesn't just serve Corydon, it serves Harrison County, Crawford County, and parts of Kentucky, impacting around 60,000 people. Like many rural hospitals, it operates on very thin margins. In 2023, the hospital lost about $3 million from operations. That's not a collapse, but it means there's very little room for error. A big reason is the payer mix. About a third of patients are on Medicare, nearly 1 in 5 on Medicaid, and many are uninsured or underinsured. These programs pay less than private insurance, even though the hospital's costs stay the same. We're already seeing warning signs. The hospital stopped delivering babies in 2025, not because families don't need it, but because they cannot recruit OB/GYN doctors. That's happening all across rural America. At the same time, new federal and state policies make it harder to stay on Medicaid, meaning more people fall through the cracks. When coverage drops, unpaid hospital bills rise, and rural hospitals feel it first. Emergency rooms can't close, staff still have to be paid, and costs don't go down, so pressure builds fast. Today, we're joined by Donn Blank, a former hospital board member, to talk about what's happening behind the scenes and what this means for the future of healthcare in Harrison County. Okay, that was a lot, but I did it. Tim, how are you today?
I am great. That was a lot, but there is so much going on both on the national stage that will affect Harrison County as well as the local stage and state stage. And there's a lot of different moving pieces here, but the bottom line is that the numbers don't look good. The revenue isn't enough to cover the costs and the liabilities, meaning the debts that the hospital has too. And someone's either going to need to bail this thing out, and that means you all who are watching, taxpayers, or maybe a purchase, or we'll get into it about how Harrison Hospital could possibly stay open during this, or maybe they turn things around. So,
Yeah.
Don, I'm so excited that you're here and have so
Yes.
much inside knowledge of this to
Yeah, I
help
want to
educate
tell
everybody.
you, yes, thank you, Donn, for being here. We've talked on the phone before, but it's really nice meeting you in person. He's cracked me up like 10 times already, you guys. He's a comedian. I'm loving it. I'm going to read a little bit of his background so you can see what a real do-gooder for the community. Like, just thank you so much for all you've done. I'm going to read a little bit about his life. It's not all the things he's done to help Harrison County, but it's some of them. So after college, Donn's worked in nonprofits since 1980 for 18 years. He's also worked with taxes with his brother for a few years, and he is a specialty at auditing and consulting for nonprofits and federally funded agencies. He's been on the Harrison County Chamber boards as treasurer, and he served as treasurer on the leadership of Harrison County for 16 years. For 23 years, he was on the board for Lanesville Heritage Weekend. Are you still doing that?
Yeah.
And he's still doing that, helping with Lanesville Heritage Weekend. That is our biggest festival in Harrison County. And he's also the chairman of his church, and now he's the treasurer of his church. So I would just like to thank you for being such a wonderful person helping Harrison County. To think of how many people you've helped. You're also on the Boys and Girls Club board, right?
Yes.
And
Yes.
we're going to have Tim. They're building right now a Boys and Girls Club close to my house in Palmyra next to the firehouse. I mean, what a gift to the community. So
Yeah.
thank you. Thank you to everybody helping with all of those things. But thank you, Donn, for being such a prominent person. Now we're going to be zooming in on the time when you were on the hospital board. You were telling Tim something interesting. So when were you asked to be on the hospital board, the Harrison County Hospital Board?
It was back in 2006, and Steve Taylor was administrator at that time, and he made a request for me to be on the board. I told him, I said, I don't know anything about hospitals. You need to find somebody with experience. He says, you've been auditing cost reports on hospitals, and they wanted someone from Lanesville because Parvin Baumgart had just passed away, and he had been the president of the board. And of course, I said, well, I've been in Corydon for 30 some years. And he said, we just need you on the hospital board. And my response was, "Is it political?" And he says, "Well, no, not really." And in Steve's tone, he knew that it had some political connections, but it was nothing back then like
what it is now.
now.
Yeah, that's what my observations about the hospital is. It's extremely political, and it's very hard to get any say if you are not very dedicated to the Republican Party of Harrison County. That seems to be one of the problems to what I've observed.
That's correct. And I'm not a big Republican or Democrat. I'm more the person.
Yes, you're more community based. You're just trying to help our county.
Right.
Yeah,
And
which is incredible.
I don't care if you're a D or an R. And when I got on the hospital, I had no idea what the other board members were, and I didn't care really. But I got on there. I accepted it.
How many people are on the hospital board?
There's 7.
7?
And the way it is supposed to work, well, first of all, everybody refers to it as a county-owned hospital, which is incorrect. Technically, it is a 501c3 nonprofit entity.
Oh,
And again, technically, the board members own the hospital. It's their responsibility. However, obviously the county is very involved, and of course they're looking at ways to either cut costs or have control, which is the big thing now. And they are the ones that appoint the board members for the hospital. And typically, and this is all what Steve told me when I first got on the board, typically the hospital would provide them a name and they would go with it. And that theory being that even though the commissioners have to approve it, the hospital board knows what we need. And we should be the ones telling the commissioners.
that's interesting. So the hospital board is pretty much telling our county government who they want on the board, and the county government's pretty much listening.
They did at one time.
Okay.
And an example of that would be, do we have an accounting person on the board? Do we have a nurse on the board? Do we have a doctor on the board? And when we would evaluate our needs, that is the things we would look for, to have a good mix. Not all nurses, not all accountants, on and on. So first 2 terms went pretty smoothly. It was like Steve said, I didn't really see a lot of politics. And mind you, we tried very hard to keep the commissioners informed on our status and what was going on.
And at this point, the hospital was doing okay because
Yes.
because now we know, like, they lost $3 million in a recent year, and that's not a ton, but right now when we're having to watch every penny, it is a concern. So back when you were on it, you were accounting for your money for the hospital.
Yes, and when you say $3 million, you have to be careful to count in the depreciation factors that go, because once we got the new hospital built, why, we had a lot of big expenses, obviously. And so you kind of have to separate, not that depreciation is not a real thing. I mean, eventually we'll have to build a new hospital. But
Sure. Let me just ask you a question, say something there. This is all public information of how much they make and where the liabilities are. And I have the numbers up here from the state of Indiana. And total net gain, it's called, was minus $4 million, meaning they lost $4 million in 2024 here. And excuse me, this 2023 report. and there at that time there was $11 million in liabilities too in terms of debts, and I think that's gone up at this point too.
Interesting.
When I was on the board, we were doing what we could to get the debt paid down to zero. And we do thank the county that they helped and pitched in 4 or 5 million. But from what I remember when I left the board, we was down to maybe 5 million in notes payable.
So the county government has been helping pay for this hospital for the last few years.
Yes, to some extent. Now, the last contribution they made while I was on the board, I'm going to guess was maybe 10 years ago. And I know the county pitched in money when we originally built the hospital. However, they were not willing to guarantee our bond issue, which, I really didn't understand that, because that would saved everyone a ton of money, and it was really not a big risk
Huh.
on the county. But
So you saw like a bad decision there, in your opinion?
yes, I do. And of course, when I talk about the commissioners, right now they're all Republicans, but they were a mixture at one time when I was.
Yeah, it wasn't that long ago that it was a mixture. Now in Harris County, it's 100% Republican. And that seems to be a problem with many things, because it's just a few people that seems to be kind of running the show without the community's best interest at heart.
I think it's safe to say the two heads of the Republican Party, they run everything. And then the commissioners, and I'll say now, I think 2 of the 3 commissioners are pretty good, but I think one's power hungry and arrogant, and and I won't get names, but I think
I don't mind saying, I'll say the names of who we believe kind of runs the county. It's okay. In my opinion, the 2 people that are running the county are Larry Schickles, and he's the park superintendent. He's also on the hospital board. I believe he took over your position and helped to get you out. And he's also on the zoning commission.
Parks.
He's the park superintendent. He kind of gave himself that job. He used to be the chair of the Republican Party of Harrison County, and then he took over park superintendent, and then he gave his friend Scott Floor, who is now chair of the Republican Party, that position. And the 2 of them seem to kind of have this authoritarian like rule on our county. And I get a lot of tips from a lot of people. I'm going to say hundreds and hundreds of people send me messages about these 2 people and about what's happening, and about how people get duped and tricked to doing decisions that they think are going to be for the county, and then it turns out not to be. For example, we lost our park. Do you know that we lost Buffalo Trace Park 2 years ago, I think it was, because of Larry Schickles doing a lot of fear tactics to our brand new town council members, acting like we are going to get sued because the dam needed repair, and just scaring the crap out of the members. They couldn't wait to give away our park. And so it seems to be scare tactics like that. He's very persuadable. He's very good at getting what he wants in certain things. Now, I also tracked that he kind of tried to stop the Boys and Girls Club, but thankfully he's not on the board of the Boys and Girls Club. Phew. And that is still happening. But I did see him work behind the scenes. He tried to stop it on the zoning board since he's on there. And also, I just want to point out, Larry Schickles does not live in Harrison County. He lives in Mitchell. He has a rental property that he does not live in. So if we wanted to stop this person who continuously hurts us, people in power, we have a really easy way. You're supposed to be living in the county when you have all these positions. So just throwing that out there, if we'd like to help. He's gone after me before, Tim. I sent you the message.
Yeah, I see him go after you, and it's also, but people have to hold him accountable. And if you have a one-party rule, that's going to be pretty hard to do, and we've seen that. And I think, often we're not speaking about doom and gloom here, or being, alarmist here. context, but we are headed for a cliff when it comes to healthcare here in Indiana. It is a perfect storm. We're already seeing healthcare deserts, as we've talked about. I live at a place where the hospital is closed, right, up here in northern Clark County. The OB program in Harrison is now closed. But where do you go to deliver a baby? Well, I guess you go to Floyd Baptist, but you don't go to, if you live in the northern part of Harrison County, you're not going to Salem because they don't have an OB program as well. Crawford, as you
Wow.
talked about, doesn't have a hospital. Bedford, I guess you can drive to, but also Paoli has a small OB program. And for context of how many babies are being born in Harrison County, at Harrison County Hospital, there were about 400 deliveries the year before it closed, a little bit more.
Wow.
And so that's about 8 babies a week. And the statement from the hospital, why that happened, is that they couldn't get the staff, is that it was a staffing issue. They couldn't get the OBs to come and staff it because they said they're just, they were always on call. You never know. There's not a huge amount of volume. So you weren't doing 12-hour kind of shifts. And whenever a baby came in, you would deliver it. Instead, you were always on call, not sure when those babies were going to be delivered. Well, I think that's a little bit of, look over here at this problem that we have rather than the problem over here. If we were able to fund these programs appropriately, that wouldn't be a problem, right? You would have staff to be able to do it. And we've seen Medicaid payments going down continually, and therefore revenues going down there. Not only that, but there's huge, like hospitals like Harrison County get payments called DISH payments, and get a little technical here, but DISH payments in Medicaid, it means that if a disproportionate amount of people can't pay for their care out of their pocket, certain hospitals get payments from DISH to say, okay, we're going to supplement that from the government. And Harrison Hospital gets $1 million or so of that money. Well, in this new budget that just passed when we had the government shutdown, they didn't renew the DISH payments. So those DISH payments are going to be cut markedly across the country by about $8 billion a year. So that's another revenue that they're going to lose. Not only that, if we don't have people have ACA, Obamacare, which we're right now know that this is going to expire at the end of the year, those people won't be able to pay for their care either. And then we know from the Big Beautiful Bill that coming very soon and at the end of 2020, in the beginning of 2027, we'll have even more extreme Medicaid cuts and Medicare cuts as well, making it just, again, I don't, how do you keep a business open if 30-40% of the people walking through your door can't pay for it? It just doesn't make sense. And so Harrison County is already operating in the red, meaning they are losing money every year. How are they going to recover from that?
Yeah, I
Nevertheless,
have a
hospitals
fact
that
about
are
the
operating in the black. Yeah.
I have a fact about the Big Beautiful Bill. It was signed July 4th, 2025, and estimates it's going to reduce federal health spending by over $1 trillion and increase the uninsured population by about 10 million Americans. So
Yeah. That's
and then
about the
it's
estimate.
harder to stay in. You got to re-enroll twice a year for, is it Medicaid instead of once a year? And then the month
Right.
it's gonna go earlier. You need to apply for it earlier. This was one of the suggestions I wanted to make to help Harrison County Hospital stay open, Donn, was if the hospital could do some educating on how to stay insured with Medicaid and Medicare, and like send it out to all the people that have used the hospital in the last 10 years, send out some sort of information graphic on exactly how to continue to sign up for it's Medicare mostly, right? For Medicare.
Medicaid.
It's Medicaid. Okay, sorry, for Medicaid. And so I would still like to help with that. How do we help rural hospitals stay open? And one of them is, well, they've got to learn what just happened, what is coming, you said in 2027.
Yeah.
And how can we protect regular people from becoming one of these 10 million that's going to be uninsured now?
Yeah. And it's what it make the point clear. Like this is this is neither a Democrat or Republican or anything. This point here, if you don't have people who could pay for care, knowing that already 30% of farmers are uninsured, 28% of truckers are uninsured, right? That already is there. If you have people walking through the door as a physician who come through the door and can't pay for care, you can't keep your business open. It's just that easy. I don't know how you make up for it, and there's going to be a program that's being put through, which is called the Rural Health Transformation Program, and that's money that will be given by the federal government that came in the big beautiful bill. It's $50 billion across the country for rural hospitals. Everybody's going to compete over that. It
Yeah.
doesn't. It's a drop. It's a drop in the bucket. It really
Right,
doesn't.
because it's 1 trillion that we
make up for it.
lost. So 50 billion and 1 trillion. It's kind of hard because they're such big numbers, but yeah, it's just going to help a teeny tiny
Plus,
bit.
plus specifically the same exact. It's trying to make up for these what I call dish payments that are being cut. So it makes up for those. It just brings us back to zero kind of thing. It doesn't actually make it better. So it's just less money in the system, less people being able to pay for care on an individual level.
It's such a
we as
big thing and it's so
we worry about
confusing.
it, but
Yeah, it's so
yeah.
big, but when we zero it in on one hospital, this is the only hospital in our very big rural county. I want to talk about the OBGYN just a little bit because a lot of people come up to me when I'm around the county doing stuff and they'll say, I used to work for the hospital, or I used to be a nurse for OBGYN, or I used to do this, or I'm still working for them. And they give me the behind the scenes, and the behind the scenes and what the hospital's putting out is two different things. So I do want to just share one thing. One former employee told me last weekend, she said, Sarah, I got an email saying that if I wanted to only be a nurse for the OBGYN, that I needed to quit, that there was no job at Harrison County Hospital anymore, and that she would need to go to another department. So on Facebook, I get the sponsored ads from the hospital. They keep saying they're looking for OBGYN. They're going to get one. It's going to open again. It's going to open again. But I have tips from real people working in the hospital saying, well, they were sent an email saying this program is done. So I just would like the hospital to be truthful. I hope that they're still looking, but behind the scenes, it looks like they cannot afford to pay the OBGYNs enough to get someone. Also, we have to kind of look at what state we're in. We're in Indiana. In Indiana, we do not have right to women's health care anymore. So if you were a newly graduate of, say, IU Bloomington in OBGYN care, and you were looking for a job, you wouldn't particularly want to work at this hospital. They can't pay you as much as a city hospital. And do you want to stay in Indiana where you might have to fight the government? The attorney general might
just
prosecute
theory.
you and take away your license, which you're paying your debt off for. I mean, there's some
That's
real
not just theory.
implications.
That's real. We've already seen that people, that graduates from IU residency program are preferentially leaving the state, whereas opposed to before most of them stayed. So that's already happened. That's real.
Well,
We're just losing OB programs.
I can tell you that this is not a new topic, and that
Yeah.
I very, again, I don't know, maybe it started in 2014, where we would start discussing eliminating that department. And my response was, why? And it was always, it's losing money. So I said, how much is it losing? And they finally came up with some numbers. And I think at the time it was between 100 and 200,000. And when you're dealing with a hospital with the budget the size we have, that's like a nickel. And someone was wanting to get rid of it back then. And when I say someone, there's always these things going around the room that you can pick out a certain board member or two members that have ulterior motives. And again, I won't name the names, but I fought it, and through 22, when I was fired, we kept the OBGYN program, and it was very important to me because what is that? I mean, you always hear about lost leaders in the grocery stores and such. Well, the most important thing to keep our local hospital alive is having our local people come there and give birth to the next generation. So that was a political thing. And I find it interesting that when you started naming the hospitals that don't have it, I think that if one was to do some research, you'll find that every hospital in our southern Indiana community that has gone under or had significant reductions became they were taken over by the county supervisors. And they
It became political.
Yeah.
Instead of putting community members first, it became political with these agendas that hurt rural communities.
the critical access is what they call the rural hospital help that we get. And it was just, I couldn't understand it. I mean, it took a couple things to happen before I would get to where I would speak out about it. First was the OBGYN dismissal, and secondly was the group that they are now affiliated with, and I can't even remember the name, nor can anybody in this county other than those that might have personal gain from doing that.
I'm sure it was shocking to you. You joined this board to help them. You have a lot of nonprofit, a lot of accounting skills, and you see the investment in the community. We need to keep OBGYN open. This is a good thing for the hospital. This is a good thing for the community. And you're kind of confused. Why are some of these people not wanting this? Well, now you see it once it's been a few years and you kind of tracked it down better. Politics, stupid politics got involved instead of putting people first, which is what Project Next is all about, by the way. And I can sense your frustration and anger because you're trying to serve your community, and this hospital is extremely needed. We cannot afford for this hospital to close. This hospital closes in a couple years, you all. People in our county will die because they will not be able to get emergency services in time. It will take too long to get care. People will die.
I mean,
Women delivering babies. I mean, this is really serious stuff. Tim?
what happens when a hospital closes, right? It's that you lose your emergency department, your ability to see people. You lose your ability to have family care and have constant, oversight of primary care for people who need it. But you also lose your EMS system. The
Yeah, your
EMS system
911.
kind of collapses. And so, and you have to figure out ways to fund that and have a place, they're picking people up in the EMS system and then driving them an hour back to Floyd Baptist, or even a half an hour back to Floyd Baptist. And that system is not profitable. And so you need to figure out a way to do that. And that is going to have to happen through taxpayer money. I live in northern Clark County. We have 50 hours of EMS coverage through our fire department here in the New Washington area. And if you call outside of that coverage, often, more likely than not, they say, sorry, we don't have an ambulance for you, because the ambulances are tied up in the southern part of the county, where there are hospitals and there's more people. And that is real. We've talked about it so many times, the stories on Halloween. I was at the trick or treat in New Washington. Kid fell off their dad's shoulders and hit the ground, and they called 911 and said, sorry, we don't have an ambulance for you. And so they had to jump in the car and drive 40 minutes to the nearest emergency department. And so that is the situation that Harrison County would be headed for. And it's even worse because the neighboring county of Washington County is headed for the same situation. And Crawford already doesn't have anything to help them
I
with.
didn't
So
know Crawford County didn't have a hospital
you're in
until
a tough situation.
yeah. Yeah.
Yeah. So
Donn, whenever you were
you're
kind
gonna
of,
be in a real healthcare desert.
we know now that politically you were not following their agenda and they needed to get you out. And so it was kind of a plot to get you off of this board. We see it now. You were kicked off for something stupid. You explained it to me. It's a stupid thing that we don't need.
Well, I'm not sure why.
Yeah, that's true. Yeah.
Nobody would give me an
Oh my
answer.
gosh. And so who filled in your spot of the 7 hospital board members? Who took your spot?
Well, I guess ultimately Larry Sickles. It was a strange year because we had to replace Lisa Clooney as the doctor on the board.
Oh, she was on the board and now she's CEO of the hospital.
And, I believe Dr. Brown took that over. He was an excellent board member. And
it was a political move to get Lisa in, from what I understand. It was sort of a push.
It was a tough sell at times, it felt, to get her in there. But
it does look like now that, go for it.
In fairness, let me say we did reach out to Lisa. I have been in communication by email with her. We haven't scheduled something,
but we are going to try. We are going to try to schedule something.
We are trying.
She is willing to
trying to get that,
talk.
So that's out there.
Right. Yeah. And I'm like friends with her a little bit, not close friends with her. And I'm more friends with her sister. So I'm not saying, I don't want to imply like I'm saying mean or malicious things. I'm just literally trying to save the hospital. And I believe things are happening behind the scenes to make it harder to save this hospital. And one of them is the politics of this, the political nature. So is there someone on the board right now that is good at accounting? Because that was sort of your job. You're good at auditing. You're good at nonprofit money keeping. Is there someone on the board now that's good at that? Do you know?
Not that I'm aware of. They have one nurse, 2 doctors, a retired banker, a retired judge, and we don't know what we'll call Larry Sickles. I guess he's
park superintendent / many other things in our county.
Politician. And then there's another one that kind of lurks around to go on whatever side is best. But
it just seems like this is good wisdom from you. Because you and I had like an hour conversation a few months ago that helped me really understand what was going on behind the scenes in hospitals. And you're saying some other Southern Indiana rural hospital boards seem to be doing the same thing. If we could take the politics out and we could put people in these boards that are not just 100% one political party, political driven, political mission, and get people that are community based, that are keep this hospital alive for the community members. It seems like that would be one thing we could do. It seems like that might help Harrison County Hospital if we made it less political, if we got somebody on that really understood accounting, nonprofits, the money. Because again, I believe, I was tracking it a little bit. I believe part of the reason, Tim, that our hospital owed money was something bad with the ambulance services. Was that correct? Wasn't there?
The ambulance services was a issue every year where the county would, I'll say, whine or complain that, oh my gosh, it keeps going up, it keeps going up.
To fund the ambulance services?
But yeah, we would go get reimbursed from the county. The county would pay for that. But it was always a fight. And I know when I said through the years, the county isn't even paying for any of our overhead. We were just charging direct costs to them. And, and the county and the population should be thankful that we didn't go after indigent care, which is rightfully, due the hospital from the county. There's a lot of things that the county is going to miss if our hospital goes away, and particularly the ambulance service, because they're, ours is one of the best in the state, and we owe a lot of thanks to Pete Martin for that, because he's the one that pushed for that for years. And my gosh, if you got to live anywhere, live in Harrison County because of that. But
I want to cover just something about this hospital in particular. I'm going to go ahead and say, and this is my words, and this is my opinion, and this is my fear. I fear that having Larry Sickles on the hospital board will lead to him trying to get this hospital closed. I fear that he has a goal in mind, and that is to close this hospital because for some reason, there's some way somebody could profit off of this if you were on the board of a hospital and a hospital fails.
Well, you have
I
to you have to find a buyer to make that happen, right? And the buyer seemed like it was going to be perhaps Norton Hospital Systems, and Norton, they had a affiliation that was starting with Norton, but Norton pulled out of that, which tells you a lot.
Yeah,
That a
it's
hospital
not good news
hospital
if
system,
Norton is pulling out of
yeah,
Harrison County and they just did it
because
all of a sudden. All of a sudden,
yeah.
Norton was gone.
And they'll take a, Norton will take a loss on a community hospital in order to expand its footprint and be able to get the more critical patients to come to their hospital where they can make more money in the Louisville hospitals or Clark Norton or wherever it may be. So there was enough there that they didn't take it. And Don, I wonder if you know anything about that. Now, as you're saying, there's a hospital system that people don't even know about. It's the Evansville Deaconess Hospital System that they have affiliation with.
Oh, that's who they've taken up with now.
Yeah,
Is
and
this
I
Evansville
don't.
one?
Yeah, and I'm not sure.
I
I
predicted,
don't know the extent of that. Don, please.
I predicted, it'd be 3 years in January when I was fired. I was not reappointed. And it really, really hurt me. The hospital had kind of been a big part of my life for many years, and odd because I was scared to death going into it. But
I so appreciate you being on the board because you were fighting for OBGYN care services, and that is so important. So thank you for serving on the board as long as you did.
the other thing that I fought for, and I think this is the tune that is a lot. I mean, I said 3 years ago, I thought the hospital would be out of business in the next 3 to 5 years. And just because of the political aspects. But as far as this affiliation with Norton, I was fighting the entire time to get Norton to where they owned 49.9% of our hospital, where we could work with them more and more and more OBGYN. Well, who cares then? Because if we need a half of a delivery doctor, Norton can give us the other half,
Oh, yeah.
vice versa.
Uh-huh.
And there was always this something floating around the boardroom with one or two of the members that, well, we need to check with other places, and they never did want to go with Norton. And I have to
And that's
wonder,
clearly the best one around here,
Yeah.
right, Tim? I mean, you're an ER doctor around here. Wouldn't
Yeah.
Norton owning almost half of Harrison County Hospital be the best solution for keeping the hospital alive?
I mean, there's in a dire straits. Yes, there's positives and negatives. There's always a positive if you can keep your hospital unaffiliated for prices for people. It'll keep prices down in the long run. Actually, prices go up, and it's been shown over and over again when you can be taken over by a larger system eventually.
That makes sense. The negative
But
side's the cost, but you cannot get care. You cannot get OBGYN care in the
Yeah.
hospital now. So
yeah, and
I
so
would say
we're in a
spending a little
situation.
more to not having it, like
we never, and of course I was on the board. I wasn't there every day, but working with Norton's, from what I could tell, was a wonderful thing. They
Made a lot
they
of
would
positive.
come in and provide training, and but again, there was something going on, and I couldn't figure out what it was, where it was coming from. But these certain board members had something else in mind.
it just seems like an agenda that wasn't community, keep the hospital alive, that is seeped in, and it is causing bad decisions, and it has caused bad decisions for the last few years with the hospital. That's what it seems like to me.
And I think if you got a good dog sniffing around on it, that you would find there's some connection between some of the board and this hospital that no one has ever heard of. And it's like Norton on one hand, Evansville on the other. Why in the world would you do that? There has to be some hidden agenda, and I don't know what it is.
I fear the hidden agenda is some people want this hospital to not make it so they can sell it off for a profit. That's my concern. And I just hope that all 7 board members, their mission is to keep this hospital going. And I think it's very easy to say fears in the immediate fears to get people to vote a certain way. I've seen it done in small governments, medium governments, big governments. I just see it done all the time. They bring up some fake fear to cause other good people that are trying to do their best to vote the wrong way. I worry that that is happening with this hospital now, especially having more information from you and my friends that have been a part of this hospital.
Well, I can tell you that Steve Taylor, the county owes him a lot, and they treated him like crap when he resigned. It was just atrocious to me what little respect was given him. You know, he was the one here that was here to build a new hospital, which is a lovely facility.
When was that hospital built?
2010, I
Oh,
believe.
wow. It looks nice. Have you seen it, Tim?
Yeah, I've been in there. I've gotten iron
Oh, that's
transfusions
right.
there.
You've had treatments there. Yeah.
Blood.
So then when Steve was ready to retire, why, and one of the rumors circling around when Charlie Crawford switched gears on me at the last minute, he went, oh, you know, he would come to my house. We'd have meetings. I made sure he kept informed, and he'd always pat me on the back and say, we really need you on there with your accounting experience, and I'm glad you're there, and we're really going to need you with Steve leaving. And all of a sudden he switched gears, and I'm not sure what happened with that.
That's a concern to me in your story about you being pushed out, and you not even understanding why. That's concerning to me because you understood the numbers and the math and you were really fighting for the hospital to keep it open. That's where I think we should be concerned, everybody in this county. So somehow people got in and pushed you out when you were trying everything you could to save the hospital. And then we put somebody on who a lot of us in the county have problems with, but he seems to be too powerful to stop. So I just hopefully more people will be aware of this and we can kind of shine a light on what's going on so that we can help this hospital stay open. That is Project Next goal here. We want the hospital to stay open. We're not trying to diss people. We're trying to look at it with a bright light at the truth that we only know partially what's going on and say, how can we make it better? Get politics out of it, get better people on the board, get an accountant person on the board, right? What else?
I think they always need a strong fiscal person on the board, and whether it's me or someone else, but it was just too much shenanigans going on. And Jim Highcamper, who was on the board,
is he a commissioner now?
He was, and he lost grace with the powers that be. But he came to my house, and you know, and I ripped him pretty well about how the vote went. And
this is after you got kicked out.
Yeah, and he said, "Well, Charlie Crawford said that you done a lot of bad things," and he never could get an answer out of him, except we got one rumor was that myself and Steve Taylor were going to form a consulting company and gouge the hospital. So in this transition,
and that's not true, correct? Yeah.
No, the truth is that Steve volunteered free of charge to be there whenever they needed him. And part of the reason I believe that it's following what I thought would happen is that not a word out of anybody contacting Steve for his help during this transition. It was like, we don't want anything to do with Steve. We know how to do it. And that was a mistake.
Yeah.
whoever did
So
it.
they're pushing out the experts. They're filling with lies and
Steve
gossip.
was not a yes man.
Yeah.
That's why
Yeah. Yeah.
most people hated him, I found out, as far as the political scene went. And then we had Nelson Steeple, who he was on the commissioners when they
And he's the commissioner now.
He's the president now.
Oh, okay.
And Jim Highcamper called him and he said, "Hey, Nelson, we hear there's a lot of things that Donn Blank did that was bad. Why y'all got him off the board?" Nelson's educated response was, "Well, he's been there long enough. I don't need an excuse of why I voted the way I do. It was time for him to be out of there." And, simple me, I would have thought, if you're a commissioner, maybe you ought to do research on why somebody's on the board before you just blurt out the arrogant things that he did. And of course, he's proven that many more times over the last 3 years that that's the way he is.
If you are in Harrison County right now and you are listening to this and you are kind of upset about what's going on in local politics, this is a great time to be upset with local politics. You know why, Tim Beck? Because we need good people to run for stuff in this county.
That's right. We do need people to run for stuff.
We need good people.
It's time.
This coming up election, we have a big chance to get some purple, to make it not 100% one political party, to get some people in that want to help the community. If you are listening and you want to help the community, you can run for something. We're going to start filling that out like after the first week in January. We're going to fill out paperwork for the next few months and get on this primary ballot.
Well, and you don't need to, you need to consider that. But to me, more importantly, is that when you go to the polls, rather than being lazy and doing a check on under
Straight
D or
party
under
ticket.
R,
Mm-hmm.
know the people you're voting for. Do a little research
Yeah.
and get people that are honest people that
two people that's going to be on the ballot: Tim Peck for Congress, Sarah Blessing State House.
There you go.
We're both trying, but it's really hard because we both got D's by our name, but we're not the typical Democrat. We're a community-based candidate. We care about the will of the people, and it's really hard to get that across because people have been told fake things about, they're just blindly believing things because of your D or your R name, and that's not true. There's lots of great Republicans out there. We need them running for stuff. We need them going against the people in power, but that's hard, but we need them.
Well, I'll say for the most part, I think a lot of the Republicans are doing a good job.
Right.
But there's just the bad apples, and people need to know stories like mine that, and quite admittedly, I would tell you before 2006, I didn't have a clue how any of this worked. And, the commissioners, they need to there's a well-written letter that was sent to them why they needed me on the board. There's not a formal finance committee, but I was the head of the informal finance committee. And it's my understanding that after I left, they just quit having a finance committee.
I think almost everybody listening to us, unless you're trying to control the hospital for yourself, everybody listening is going to say, yeah, we need a good finance person on the hospital board, right? I mean,
Yeah.
Tim, isn't that kind of a duh?
Seems
So
101. Yeah.
yeah, maybe that's something they could work on first, because we got to have the money to keep this hospital open. Now, Tim, you had you said there's a plan to keep this hospital open that you found out. What is that plan? And let's see if Donn agrees with you.
No, I mean, what I heard is that, or what I've pieced together from a number of different people, from the financial sheets that I've read, etc., is that they're losing a good deal of money each year. They're going to continue to lose and lose even more. They were very hopeful around these extra payments coming from the rural health transformation program from the Trump administration, but I just recently seen a bit of where that money's going, and it's just not going to be enough, if any, goes to Harrison County. But some may go, and that there are even more cuts, but that there's a lot of bills to pay, and the financial sheets show that. And Donn, this is a little technical as the finance guy. It looks like they're saying that their assets are $36 million. Is that the hospital building that they're considering? Is that much? I don't know what assets they're talking about that they could sell to
Yeah, I
cover
saw
some of
that
this
too
debt.
in my
So
research. That
No,
number.
that would be correct. That it's the building plus all of our equipment, which of course the equipment is very, very expensive. I remember the first or second meeting I was on the board, we were talking about buying new TVs for the hospital. And I don't know anything of you's been in our hospital, but they're little TVs. And we were paying $600 a piece for them. I said, now what is up with this price on these TVs?
Right.
I said, we can go to Walmart and get them for 200. Well, we have to have certain TVs that meet requirements with, I guess, the radioactive way, technical stuff that I didn't know the answer to. But there's a lot of things the hospital has to do to be in compliance with the Department of Health and the state guidelines. But
I guess my question, Don, is that $36 million a strong number? Who's auditing that? Because that's the big concern. Because if you're losing money and you have $11 million or more in debt, but you have a lot of assets to cover that, you can continue to borrow money forever, and run your business that way if you have to. But I just don't know if that building is really worth that much, or and who would be the potential buyer for it, and everything in a building. Like you said, the medical equipment is expensive, but it's like a car. Once you get it off the lot, it depreciates quite rapidly. I just don't know.
is that
My concern is who's coming up with that number, and is it auditable?
is that net of accumulated depreciation?
Yeah, that's the final number
The
on the
net
balance
value.
sheet. Yeah.
In answer to your question, well, there's several parts of the question, but um, I think we have a very qualified audit team that's in there.
Good.
They, I worked with them a lot, and I think they're still doing the audit as far as I know. That's one thing that the
That's
people,
great.
those wanting control, I'm surprised they haven't fired the audit firm if they haven't. But I had a lot of trust in what they did. Could we sell the hospital for 36 million? Absolutely not. Who would pay that for it? But from a accounting standard standpoint, if we had 50,000 in the building and we depreciated it, that's proper accounting. So,
Yeah.
um,
So proper accounting, and then the fear is when you get your debt to asset ratio, for those people who are into all of this, into a bad place, you can't really borrow money anymore. And so, is the hospital borrowing money from anyone besides the county and the taxpayers themselves? Like, do they get loans from banks as well to cover all this operating loss that they're having?
when I was there, when I left, we had more cash than we had debt.
Okay.
Um,
So the cash on hand number I can't find and didn't see. So not sure how much cash is sitting around to be able to cover these.
yeah, we were in good shape. And again, these are guesses, but I'm thinking we may have had 12, 14 million in cash. And I'm thinking the debt was down to 5 or 6 million with our bond issue. And then that was through, I believe it was First Savings Bank that worked with his son.
Okay.
But
So you were able to
uh,
get
But then we also,
Loans. Go ahead, keep going.
yeah, we also now own the medical office building next door.
Hmm.
That started out where it was a partnership. Hospital owned 50% or 60, and the doctors working in there, they were owners. And I'm thinking it was about 6 or 8 years ago, we bought them out. So the hospital owns
Is
that
that
building.
making money for the hospital?
Yeah, it was a good move. We paid them fair market value for their interest, and that building has some value as well.
Hmm.
Uh,
That's good.
whether whether the banks are going to want to loan money, I don't know. I think it's
Yeah.
more than coincidence that when Steve Taylor retired, that let's say a lot went to crap. Um,
Yeah.
and I'm not in any way going to blame Lisa for all of that. I know that there's changing times with the reimbursement rates and the government, but I also think that strong desire for the commissioners and a couple of the board members to have complete power, that took its toll as well.
I really want everybody to just, those of you that are invested in this hospital, do some research on Jamie Knoll, the former sheriff that's in prison now for taking over $5 million. There's so much more, but the time had passed for how much you could charge this man for his crimes. So he's in jail now for taking taxpayer dollars. I believe he took both state, like county, state, national. He and the way he was able to get by with it, the way he was able to take tax dollars is very important for all of us that are involved in the hospital and with tax dollars. Commissioners should be well aware. How was Jamie Knoll able to do this? County council, board members, anybody that has to do with taxpayer dollars needs to understand how Jamie Knoll was able to do this in the state of Indiana for so long and how hard it was to stop, because it can be easy to take taxpayer dollars. You can get away with it with things like kickbacks and money laundering. There are things you can do, and it's really hard to stop it. Um, just the way it's not transparent enough, just the way Indiana laws are. So my advice to people that are invested in the hospital: look into how Jamie Knoll was able to do this, and let's see, is there anybody that seems to be not putting community first that may want the hospital not to survive? Let's just look there. Let's
I
just
mean,
look
so
for some
the way Jamie
similarities.
Knoll got away with it for so long was that people wouldn't stand up to him.
Right.
So many people knew what he was doing. Um, and we're part of it, and no people just didn't stand up to him, and you've got to hold those people accountable. And if you're part of this Harrison County government right now, and and see some of this going on, and you have information, it's your responsibility to people, not responsibility to keep your job, right? and
Yes.
and maybe have them come after you to get you out of your position as commissioner, or whatever it
I,
might be. It's your responsibility to speak up and show about this. Yeah.
I can tell you that um, in no way do I think the hospital is special when I say the commissioners appoint people. Some of the commissioners will appoint people for their own political agenda. They do a lot of appointments, and the hospital is just one little piece of it. But it really, really got worse with the hospital uh, probably around 2014 or so. I know Kenny Solomon is kind of the one that started the attitude that I don't care what the hospital wants. I'm going to put there who I want there.
Hmm.
And the first victim was Pete Martin, who had dedicated his entire life to that hospital. He was 82 years old. He wanted to serve one more term. He was in good health. He was there every meeting, and they fired him. didn't even have the courtesy to call and tell him. They put in what we thought was a plant. And of course, not everybody, but most everybody hated the new board member because we loved Pete so much. And the new board member's name was Ron Hendiges. And once we got to know him, he was, to me, one of the best board members we've ever had. And of course, that didn't make them happy. They fired him. They got him or didn't reappoint him. The next one was Fred Owens, who was president. And he was a very good board member. He had very good business sense. And I don't know if he done something or said something to one of them, and they took him off. And it's just a game.
Yeah.
I remember
It's a political game.
I've got a client up in Chicago. I was up there. It's probably around 2014 or 15, somewhere in there. I had just been reappointed to the board. And Steve Taylor calls me and he says, Don, you hearing anything up there about rumblings going on down here? And I said, not a word. He says, well, they meaning Larry Schickel, Scott Floor, Kenny Solomon, they're wanting to unappoint you because they found out something important, and that is that you voted Democrat in the primary in 2008 or 6. And I did, because my friend Roger Davis was running for judge. And certainly I wasn't ashamed of it, but because of that, they spent money on attorneys. We had to spend money on attorneys to make sure they couldn't do it. And lo and behold, they found out the only way they could get me off would be the hospital board vote me off. I was to resign or I died. And I think that's a good example of the mentality that is used.
Yeah.
You know, it's not, well, does he help the hospital? Does he something he can offer? Or did he vote Democrat one time?
Yeah. Yeah.
And, you know, that's got to stop if we're going to do things right. And I know 2 of the current commissioners, and I would like to thank Brad Wiseman. He was on the hospital board with me, and he was very pleasurable to work with. And of course, Anessa, I know her through Lisa, and I think Anessa wants to do what's right. But again, you know, are they going to withstand the pressure of their bosses?
Well, before we end this show, which we're going to end in just a minute here, what Tim said is right. When you have somebody that's gotten too powerful and people they don't know how to stand up to them, you see real damage done. The damage Jamie Knoll did to Clark County and to Southern Indiana and all of Indiana will last forever. It's permanent damage that we're still trying to recover from. Harrison County, it is our responsibility, you and me, as people that live in this county, all of us, it is our responsibility to join forces, regardless of political party, or even if you like politics, and to stand up to the people that are working behind the show, hurting us all. And that's what I want to get across before we stop, you all. We can do this. We can stand against this. But if you are in some position of power and you could just simply say, look, maybe this person doesn't live in the county. Maybe this person is on too many things, has too much control. If somebody can put, well, it's okay if I don't stay as commissioner. It's okay if I lose my power. Let's just take down this person hurting us. That's what we have to do as a county. We all need to work together and stop these few people controlling us. And then we all get on the ballot, Republican and Democrats, because we got an election coming up, you all, and we need to fill it out before May. We need to get on the ballot and we need to vote people in that put community first. And we can do that. And it is coming up soon. So let's do it, you all. Put message in the comments if you know some stuff about this hospital, Harrison County, anything going on. Put it in the comments. Share this episode. If you listen, tell everybody. Let's save the hospital. Let's make our county government better. Let's try. Tim, any last words? I know you got to get going.
Yeah, I just want to say I would love to speak to Dr. Clooney, who's the CEO of the hospital. We have been in contact, and just to be transparent, based off of what we've been saying, I just want to read what I said to her and what my intentions are in terms of trying to help Harrison County today. So, just quickly, the meat of this email to get in touch with her, it says, I'd love to talk to you about your successes and any concerns you may have about the future financial health of the institution. In our current legislative environment, your hospital has been flagged through the work of Republican Senator Tom Tillis and others as one that would close if the big beautiful bill is implemented as planned. Your OB program is closed. There's concern about Norton affiliations being severed, but there's also so much good Harrison Hospital does. And I'd like to be able to not only discuss the facts and your vision for the future, but how I can be helpful in educating our community through my own campaign and through Project Next. And so, that's the idea, is to be able to share the truth and the facts of what's going on so we can be prepared. And if the news is bad, the news is bad, but we need to know that too.
We shouldn't cover it up.
So,
Yeah, let's look at it
yeah.
and try to fix it and not cover it up and pretend it's not there and then bam, the hospital's closed.
Yeah. So,
yeah. Thanks, Tim.
Absolutely.
Thank you, Donn. Thank you. That was really brave of you to come to my house and do this live show with me and tell your side of the story and tell what's going on behind the scenes in the hospital. Thank you for all you've done for our community. It means a lot to me. And I know it means a lot to all of us. And I'm just speaking on behalf of Harrison County residents. Thank you for your years and years, your decades of work helping this beautiful county where I'm raising my children.
Well, God has blessed me with certain things I can do halfway well, and it's my honor to be able to do those. But I think the point is well taken, that look to see what happened up in Clark County. And we've had it happen here
We sure
in smaller amounts.
Yep.
But and some of the names we've been mentioning was involved with that. But
maybe we don't keep putting them on more boards. Come on, you all. Can
Yeah.
you just stop?
yeah, and it disappears.
I remember when I'm like, what, zoning? What? He's on zoning now? I'm like, it's hard for me. I'm trying.
But I'd also like to say that Lisa Clooney has been put in a very precarious situation, that she's not been allowed to get help from her predecessor. And
I think we need to untie her hands and give her some more power, and we need to stop the political strings messing with this hospital and messing with the people trying to do the best. I know Lisa wants to keep this hospital open. I know she's trying. Let's let her do
smart.
it. She's smart.
And
She's
I
very
think
smart.
Lisa wants to do the good of the people, but in order to keep her job, once again, she's got to compromise because of the heavy hands immediately above her and above them.
Yes. All right. Well, we'll talk more about rural hospitals as we go. Tim, you got to go. You're a very busy man. My birthday's tomorrow, and I'm doing a show with Christopher. That was what I wanted for my birthday. So catch that. That's Christopher is a Republican, and we talk about coming together and compromising. And and so that's a fun show. So we'll be doing that tomorrow for my birthday. And Tim, I hope you have a great day. And do you know, Tim, I'm doing a show with your wife next week about Taylor Swift. Do you know this?
No, she didn't even tell me this. When did you arrange that?
I arranged it. Missy and I meet Tim's wife on Tuesday. I think it's at 11 Eastern Standard Time. Swifties. We're going to talk about, if you don't understand why we love Taylor Swift, we will explain it to you.
We know there's a local connection with her.
Yes. And Emily, is it Stumler? Emily Stumler is running for what's her name?
She'll be next
prosecutor. She's running for prosecutor. Tim, she played violin on tour with Taylor Swift.
Oh wow, that's pretty cool.
Yeah,
they were buddies before.
They were friends. Yeah, so that's cool. So yeah, that's coming up. I can't wait to have Missy.
I have a feeling this is going to be our most watched show.
I'm so excited for it. I'm full on watching Taylor Swift stuff. I cannot wait. Okay. You guys have a wonderful day. Thank you, Donn. Thank you, Tim. And I'll catch up with you all later. Please share the
right.
show and let's save rural hospitals. Bye, you all.